The work that I'm going to present that I've done myself is on trying to find biomarkers that can help us predict the outcome of our patients. I've started this microRNA work during my time back in Sydney, and there we identified a combination of 6 microRNAs measurable in tumor tissue, with which we could separate our patients into those with a good and those with a bad prognosis. At present, I'm basically trying to validate this in an independent sample set, now in Zurich. And what we found was that this signature did not work particularly well in the sample set that we have available in Zurich, and we're wondering why that is. And what we found was that in the Sydney set we had patients that had chemotherapy and patients that didn't have chemotherapy before, and we couldn't really say if the microRNAs are affected by the chemotherapy treatment. In Zurich we have samples available from the same patient before and after chemotherapy. So when our score didn't work particularly well, we actually looked at the expression before and after chemotherapy, and we found that some of these microRNAs that are in our prognostic score are actually changing based or after the chemotherapy. So what we've done now is to basically refine this initial score to kick out everything that was affected by the chemotherapy, because our actual aim is to measure these biomarkers in the sample before the patient receives chemotherapy. It's not just about predicting the general outcome of the patients. What we would like to see is a microRNA signature, possibly in combination with other prognostic factors, with which we can actually say, okay, this patient does have a really good prognosis. This patient should have the standard treatment, chemotherapy followed by surgery, while other patients may not have such a good prognosis, and we want to spare them the recovery that they might have after an extensive surgery, and surgeries in mesothelioma are very extensive surgeries. We are basically at the stage that we have, in a small sample set, defined this new chemotherapy not affected by chemotherapy microRNA signature, but that was only a small sample set. So at present we are further validating that. We're increasing the number of patients. We at the moment have data on 34 patients. A total we will have about 140 patients where we can measure that. So we are in the stage of validating this. But what we're also doing is we are doing a more comprehensive profiling, not just looking at these initial 6 microRNAs, but we're actually profiling microRNA before and after chemotherapy in those who responded and those who didn't respond to chemotherapy, trying to find some microRNAs with which we might actually be able to predict if a patient is responding to the standard chemotherapy. Because again, when it comes to the treatment decision, if they don't respond to the chemotherapy, it might be better to operate them straight away rather than waiting for 3 months to do the operation, during which time the tumor is progressing. So we're further interested in trying to not only validate, but also find something that is predictive of the outcome of chemotherapy. We're also trying to understand if these microRNAs are actually playing a role in the development of the disease. So we're doing some functional investigation, replacing microRNAs or inhibiting microRNAs, trying to see if we can alter the growth of mesothelioma cells.